Hi, so the question is, how do I know if someone has Alzheimer's disease? Well, with my mum, she actually referred herself to her doctor when she felt like she was having memory problems in a way that were kind of new and a bit too consistent for her liking. So she went to the doctor. The doctor referred her to the hospital to have a brain scan. That was almost the first course of action, which is really interesting, but perhaps surprising for anyone that hasn't been down this path before. At the moment, in 2015, there's no cure for Alzheimer's disease, and even diagnosing it is really hard. So the purpose of the brain scan is really just to kind of rule out a whole load of other things that could be causing some of the symptoms of Alzheimer's disease. So it could be memory loss, it could be that on its own, or it could be that together with things like anxiety or paranoia. So for my mum, the brain scan came back and she was sort of other conditions and diseases were ruled out. And the next step for her was the GP, I think, referred her to the memory clinic. So that's very much a UK thing. Not sure how it would work in other countries. As part of the National Health Service, we get these amazing memory clinics, which are staffed by consultant psychiatrists and psychiatric nurses. There's a whole group of people, and they're amazing places. The first thing that happened when my mum got referred there was she had an appointment for a home visit, and a very detailed assessment was undertaken by the lead psychiatric consultant. It took about an hour, maybe longer than an hour, and then following that my mum was added onto their books, and she's been on their books since then, which is roughly about 5 years now. And the really good thing about that is that they are keeping an eye on her, and every 6 months they assess her. A psychiatric nurse comes to her home and does a mini mental exam with her, and the interesting thing about the mini mental exam is that it's always the same questions. So it really gives the psychiatric team a baseline on which to compare what's happening with the person and whether they're getting a little bit more fuzzy with their answers. And that takes much less time to do. That's probably about a 10 or 15 minute assessment in about a half-hour visit. So that was my mum's journey, her initial steps having been diagnosed. Well, suspected Alzheimer's disease was diagnosed for her. As I said, you can't at the moment know for sure whether it's Alzheimer's disease until after death, and have a look in the post-mortem at whether there's brain shrinkage and if amyloid plaques can be detected, amongst other things. So I hope that my journey, my mum's kind of initial steps down this road have been useful to you as a kind of a pointer. If you want to dive any deeper into any of the areas that I've mentioned, then I am going to be posting more videos here, so subscribe and you'll find out when and what is being added. Or you can send me your question about Alzheimer's and I'll try and give you my video answer. Just send a tweet to answers to ALZ. Okay, thanks.